Autoimmune Hepatitis Association members, guests, caregivers, and loved ones. On behalf of the Executive Committee of the AIHA, I welcome you to Indianapolis in the second Patient Support and Education Weekend in Indianapolis, Indiana. We're so happy that you are here. I want to first start by introducing our Executive Committee. First off, my name is Craig Lammert. I'm a hepatologist at Indiana University and also the Executive Director of this organization. I want to pay attention to Sharon Gordon, who's in the front of the auditorium today as our National Conference Director. Sharon, excellent job. Lisa Devereaux as well. Lisa, I don't know where you are. Linda Howlett is our social media editor, and other board members, J.C. Crosby, Luke Britt, and also Lori Max. A really key part of today is to remember our mission at the Autoimmune Hepatitis Association is really to provide support and hope to patients and families that are affected by this disease by providing high-quality, free of financial bias education, and we also want to provide the provision of research opportunities. We know there is a genuine need for the AIHA, and this is something that we harped on last 2 years ago when we first formed this organization. We need a visible bastion for AIH. Prior to our formation, as you saw in the video, there was very little support, at least in terms of support groups or some physical connectedness. We need national and international attention. We want to help to direct AIH patients as well as providers in that interaction with hepatologists or gastroenterologists. We want to support the advancement of AIH research. We want patients to be educated. We want them to impact their own course of illness with their providers and really partake in that shared decision-making. We also want to improve the caregivers and the support network of friends and family by education as well. We think informed patients will do better. AIH is at an intersection of three things. This includes with management, treatment, and outcomes: science, art, and luck. Unfortunately, for too many years, we've relied too heavily on luck, and we'd like to shift this paradigm, ultimately moving to more of a model that is founded in science with a little bit of art and a lot less luck. We know there are some significant gaps in clinical research with AIH, challenges in diagnosis and prognosis, biomarkers for high-risk disease diagnosis, and how do we treat these patients? Do we be more aggressive with them from the get-go? We need to know genetic factors or other biomarkers that help to predict outcomes and or diagnosis. We also would like to know better markers for response to therapy. We have challenges in therapy. We have first-line therapy that is also off-label, but second-line regimens, there's very little data on this. We also are very interested in regimens that are steroid-free. Recurrent disease after transplantation, you'll hear later, 50% is possible. This can lead to significant problems in the post-transplant patient. We don't understand this well and why it happens. We also believe extrahepatic symptoms, particularly symptoms relating to the whole body system, are probably some of the most important things to AIH patients. We would like to know how to handle this, manage it, but also even quantitate it. We want improved treatment outcomes, bottom line. The conference aims today, we want you to identify and bridge gaps for you. Not only for you, but also your loved ones, but also with your providers. Again, we want you to return home with a wealth of information to share, to be an active participant. We want to provide the tools to really bring to all the individuals in your care, including ancillary staff. We'd like for you to meet each other, and again, this is a family. And everybody has a story, if I have learned anything in the past 4 years at Indiana University, and also associated with AIHA. We're going to see a number of different talks today. These are really formed primarily for patients. Patients help to develop the content of this conference, so we hope you enjoy it. We are going to focus again on the liver, but outside the liver as well, as this probably leads to more impact and quality of life than anything. We also want to embrace complementary approaches, at least in some scientific rigor. We'll have 3 open but moderated forums. This will happen before lunch today, at the end of the day today, and at the end of the day tomorrow. If you will, save your questions, write them down. We'll have open mics at those times. Also, if the conference or the speakers go short and they have time, we will harness questions at that time as well. Finally, our disclosure, and very important. We cannot replace your treating physicians. We are offering opinions. We are offering you at least some evidence-based data. We will discuss off-label use of medications, so important to know this. We also know social media is quite critical for this conference, and pictures can be shared. I would ask that nobody tags patients or caregivers without their permission.